Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and this is another in the series of Facebook Live events that we've done over the last several weeks. I know last week we were a little dour because we didn't have very good news, but I think this week we're starting to see a little bit of good news. And let me go through those. So the first bit of good news is that the number of cases in Oregon has started to slow down. While we continue to have new cases each day, the number of new cases is beginning to slow down, suggesting that we as Oregonians have done a good job with social distancing. So thank you, thank you, thank you. We're into our second incubation period, and that's when you should start to see a decrease. So not only are we seeing decreasing numbers of new cases, we're also seeing decreased number of visits to emergency rooms for illnesses that might be COVID. So at one point, about 7% of the visits to EDs looked like it could be COVID. It's now down to about 3%. So that is really good news. You know, I don't think we're out of the woods yet because you really need to see this for more than a few days. But this is the first time we've had that good trend. So thanks to everybody who's done it. The other thing I want to talk to today is about masks. So there's been a lot in the news this week about masks. This is a homemade mask that my wife made, and I'm actually going to wear it during this next section and point out some of the advantages and disadvantages of wearing a mask. So let me put this on here. My wife made it. I think it's really quite adorable. So you've been watching me for 5 hours, and I almost never touch my face because I've learned that touching your face is one way to get a germ. But I'll bet during this time I do, because masks are really annoying to wear and they're problematic. You probably can't hear me as well. The other thing that happens is you can't see my facial expression. And typically when we look at people's facial expressions, we really look at their mouth. Are they smiling? Are they frowning? Are they showing signs of distress? And you really can't see that without the mask. So as a pediatrician, we try not to wear masks unless we have to, because kids are not fond of me to start with, and they're much less fond of me when I wear a mask. Now, this is pretty annoying, although it's a pretty good mask that works here. And so what's come out new about masks? Well, a few weeks ago, if you listen to everybody who's, don't wear masks, they don't help at all. And if you remember what I said is, well, there's not a lot of good data. If you want to wear a mask, that's okay. If you don't want to wear a mask, that's fine too. There's new data out suggesting that people are most contagious in the day or two before they're symptomatic. So again, you get the illness, about 5 days later you start with the symptoms, but we think in the day or two before that you tend to be you might be quite contagious, because there are a couple of really good cases. There's this lawyer in New York, there's this woman in Korea, there's this South African guy in Connecticut who had very well detailed movements. And what we found is that they really infected a lot of people in the day or two before they had symptoms. So, for example, the fellow from South Africa, he went to a party, infected 40 people at a cocktail party, and then flew to South Africa. During the flight, he started getting symptoms, got tested when he was in South Africa. So it's very clear what his movements were and very clear what his contact was, and he infected a lot of people. This mask is really annoying me. Really affected a lot of people. So there's a concern that people who are pre-symptomatic may be really contagious, and so that wearing a mask doesn't really prevent the person wearing the mask. It helps the person who's wearing the mask, if they're getting symptomatic, from spreading it to others. So it's sort of backwards of what we were thinking before of wearing a mask to protect yourself. This is now wearing a mask to protect others, because you can't tell when you're pre-symptomatic because you don't have symptoms yet. So that's the reason about masks. And so I think that's not unreasonable advice. The problem, unfortunately, is you can't just go to the store and buy masks. The masks are sold out now for weeks and weeks and weeks. But the data suggests that the homemade masks, at least for the person to prevent illness, are perfectly adequate. And the good news is we've already had several hundred made in the city. They've gone out mostly to clinics to start with to give to sick patients. But we think over the next several weeks we'll have more and more, and we'll be able to get masks for people who want them. So hopefully on Friday I'll have much better information about how many we have and how to get those. But that's the story on masks. And again, this is really annoying. I didn't touch my face, but it's annoying because what happens is, unless the mask is incredibly well fitting, it fogs your glasses and it gets hot inside the mask. And so if you're not used to it, it is a tad annoying. So I'm going to take it off now. so I can really talk. Okay, but we're still recommending masks for people who are symptomatic, and if people want to wear it other times, hey, I'm all for that. The other good news is on testing. Last week I was talking about the backlog. We were days and days behind on the testing, and that was so darn annoying. We're now the backlog is down. We're down now to 4 or 5 days, which is still 3 or 4 days too long, but so much better than a week. And the backlog is being resolved. We're able to do these tests and get the results back pretty quickly. So that's the good news here. Our testing clinic is still open, so our drive-through is going to happen on Friday and Tuesday. We are still very short on the supplies, but we have enough to last for Friday and probably Tuesday. And we're going to do one in Reedsport. So for anybody's listening from the Reedsport area, we're going to do one in Reedsport on Saturday. Again, if you want to have it done, please go ahead and put that in there. The other thing I want to talk about is the positive results. And I've gotten a lot of grief about not telling people where they live and whatever. And I'd said in the past, they're everywhere in the county, so you need to do it. So I had somebody from the county make me a little graphic here. So let me show it to you. So this is Douglas County, and these are where all the cases are. And people tend to stay within about 5 or 10 miles of where they are. So we have a 10-mile circle around here. And now, since there are enough patients, we can go ahead and give demographic information without spilling the beans. So the patients are male and female. They're in their 40s, 50s, 60s, and 70s. We have nobody in their 80s, nobody less than 40, both men and women. And this is where they are. So starting down in Canyonville all the way up to Rice Hill and out to Reedsport. So when I said in the past, they're kind of everywhere. And when you look at where they've been, you see all of these overlapping circles. So you can see that people from Oakland may come to Roseburg to shop at the Costco, or people from other places may go down to the casino. So people do go up and down the freeway. So my previous advice that this stuff is out there, we have to treat everyone as if they could be contagious, did indeed come to be true. So we're going to take some questions today. Last time I saw on the Facebook thing that people were upset that their questions weren't answered. And there were some questions we didn't answer, some because we couldn't get to them, and some because we've answered that question at least twice before. So when we've had a question that we've answered twice before, we tend to pass over that question. And I would encourage you to look at the past Facebook Lives that have those questions. And if we don't get time or don't get around to your question, if you'll leave it there, sometime when I have a free minute, I'll look on Facebook and I'll try and answer the questions on Facebook. Again, the call screeners are doing an incredible good job of getting these questions out here. So we have to be nice to them. So if you have questions, put them on the Facebook Live comment section. And so our first question was, tell us about the vaccine, the cure, the timeline, and the process. So the process on doing a vaccine is you need to find something that on the virus that your body reacts to. So it's usually a protein or a carbohydrate or a mixture of those on the surface that your body makes an antibody to. And then what you do is you take that stuff and purify it, put it in a vaccine, inject it into people, so that when they inject it into people, it won't cause any illness, but will cause you to mount an immune response that will then protect you the next time you get that. Well, it turns out that there are a lot of proteins and a lot of glycoproteins, a lot of lipids on the surface. And because there's so many different funny things on the surface, it turns out that because a lot of things like that on the surface, you're not sure which ones the body makes good reactions to. For example, staph has got lots of things on the surface, and we've tried to find the thing that your body reacts to, and we've not been able to find it for years and years and years. So it is concerning. The other thing that people ask about is the treatments, especially the hydroxychloroquine. Well, I'm really confused. That there was a lot of hype about it about a week ago, based on what we could tell was no data. Dr. Fauci, who's from the infectious disease, said earlier this week, it doesn't look like it's hopeful. And then today, a report from the Chinese suggesting it was maybe slightly helpful. In New Orleans, they've been using it a lot, and they don't find it to be very helpful. So hydroxychloroquine is going to be one of those kind of things that we need to look at to be sure. Oh, sorry. Making a noise here. Okay, so is there any info on when the antibody test will be available? And that's more good news. So I'm all about good news today. So, in the past I said I would believe it when I saw it, and I saw it today. So they actually have it for order. It's not quite available yet, but I actually saw the spec sheet, and what it did is it looked at the antibody levels depending upon when you looked at it. It compared them against the Korean volunteers that they did this with. So it looks like this antibody test will be relatively soon, hopefully in the next few weeks. So that is good. So Sarah asked, should we be wearing masks or scarves in public? And so the answer is maybe. And again, I'm touching my face much more now than I normally would. So again, wearing masks and scarves might protect others from the illness. It probably doesn't protect the wearer very much. But for example, if I was pre-symptomatic, that's going to come up with the disease the next few days, me wearing this mask may protect others that I came in social contact with. Now, we arrange for them to be far enough away that they're not, but maybe it would. So if you want to wear them, great. Scarves are, I think, quite attractive, so we may want to do that. I'm going to take it off, though. So Christina asks, does hot water, tea, or coffee kill the virus? I hope. I drink about 10 cups of coffee a day, so I should be good forever. It probably doesn't. So this virus really lives deep in your lungs, and you really can't get any hot beverages down into your lungs. Germs that live mostly in the nasopharynx, so like some of the rhinoviruses, rhino standing for nose, the rhinoviruses really live in your nose, and that doesn't work very well. Strep lives mostly in your throat, and hot liquids don't work for that, so I think probably not. So how bad is this for diabetics? Well, diabetes is one of those things that tremendously increase the risk of death. So this is a real risk factor for diabetics, and they should be especially careful to stay home and avoid sick people. So Candy asks, what are symptoms that should prompt a call or a visit to the doctor? Well, you can call anytime. Visits, I would always call first. Unless it's a true emergency, I would call first. But the things that we worry about, not so much cough, not so much fever, shortness of breath is what we worry about. And so you may have heard this, like count to 10. If you can count to 10, you don't have coronavirus. It's a little wrong. Basically, that means if you can count to 10 on one breath, it means that you're not dyspneic, which means you're not short of breath. The other way to do it is when you're well, walk up and down the stairs and find out how many times you can walk up and down the stairs without getting short of breath. So that if you get this, if the number is markedly decreased, then you are short of breath. So the very simple way that people do this is we usually ask people to say the alphabet fairly slowly, one letter at a time. If you can get all the way through the alphabet or at least past T, you're not short of breath. If you can't get past C, you're pretty short of breath. And so that's the measure on doing that. So shortness of breath especially should prompt a call to the doctor. So that if somebody has recovered from COVID, can they visit family? Yes. So if you've recovered, and that means that all of your symptoms resolve for 3 days, you can visit families. It turns out that the people who've recovered are the least likely to re-get it, so that would be great. So how long are asymptomatic people contagious? We do not know this, right? Asymptomatic people are particularly hard to follow because they have no symptoms. What we do know that in China and Korea, they tested a lot of people who had positive tests and said, really, I didn't even know I was positive. And we found that they were not as contagious as the people who were symptomatic. Actually, it appears the pre-symptomatic people, so the people who are going to have bad cough a day or two before they actually have the cough, seem to be the most contagious. Mike asked, does a hot steam room help? Well, hot steam is great. In the steam room with the wire or whatever is just fun to be in. It probably doesn't help with this virus. Again, you'd have to get the temperature down in your lungs to 130, and it just doesn't work. So is COVID-19 airborne? Michelle asks. Well, so there is a distinction between medical distinction between airborne and droplet. All of the other coronaviruses seem to be carried by droplets. There are only a few diseases which are airborne: tuberculosis, measles, and chickenpox. We do not think this is airborne. We think this is droplet. So does a bleach solution kill the virus on surfaces? Yes, and I don't have on the top of my head the optimal solution. So if you check on the CDC website, or our people can check here what the optimal solution is. Bleach is very good against this. So bleach is a good thing to use, but I don't want to commit this until I know. So should you use Tylenol to treat the fever or let it run its course? So as a pediatrician, lots of kids get fever, and lots of people ask me about what they should do for treating the fever. So fever is your body's response to help fight the infection. The germ actually doesn't cause the fever. It's your body that causes the fever. And that's why really old people sometimes don't make a big fever response, because their body is just not strong enough to do it. And the reason why kids get these really high 104, 105 fevers, because their body is really good at making that immune response. So what we say in kids is you should certainly use Tylenol if you're uncomfortable for the fever. So, kids are crying and achy because they got a fever. Giving them Tylenol is fine, but I don't think you have to treat the fever just because the fever is there. If you're powering through it, no need to use Tylenol. So can the virus live in air for 3 hours, Sydney asks. Yeah, they've done some studies, and if you make an aerosol of the virus and then just spray it out there and then check, 3 hours later you can still find some virus. It's unknown whether that virus is still in a big enough amount to cause troubles. The recommendation from CDC is that you have a room where somebody was in the room. After 2 hours, the room is good to use. So if you don't clean your cloth mask, is it more likely to make you sick? Well, not from coronavirus, but it's likely to make you sick because these things stink after a few hours of wearing them. So it may make you sick to your stomach, but I don't think it's going to make you sick from coronavirus. Yeah, so what we recommend is in people who use cloth masks, if you need to use a cloth mask, stay in, but if you do need to go out, to wash it each night. So you might want to have 2 or 3 of these that you circulate. So is the first person recovered yet, Phyllis asks. And the answer is, in Oregon, we're using the no symptoms for 3 days. And my understanding is that the first person is still coughing, so no. So this was about shoes. Do we have to take our shoes off and Lysol the shoes? We don't think actually this is transmitted that way. I mean, there are some things that are. So there are a bunch of diseases we would say you want to be really careful with that. This is not one that we think is that. Dr. D, do your loved ones approve of your mustache? The answer is they had never seen me the other way, so they got to take me as I am. All right, do we have more questions? All right, let me go through a couple of things. Here, a couple of things. One is about the people who are making the masks. So this is Oregon Serographics, and on Facebook they're the Umpqua Sewing Warriors, and they've over 1,000 given to hospitals, fire, EMS, and clinics. And again, as they make more, we are going to figure out a way to go ahead and get them out to people who want them. That's going to be a little bit of an effort, right? Because we're asking people to stay home, but we'll figure out some kind of very innovative way to deliver these to your house. And so Emily says, there's a veteran who needs a ride to get to the testing fairgrounds. Are there resources available? And I hope so. And so am I scared about getting the virus? A lot of people seem so scared. And the answer is not particularly. When I collected all these swabs, we used very good protection. I'm pretty good about not touching my face when I don't wear a mask. And we're very careful in the clinic to use masks when we need it. I've been very good on social distancing. I have been over the last week counting my social contacts or my close contacts, and I've only had one each day, and that's been my wife, and we're going to share what we have. So I've not really had anything that would be considered close contact in the last week, so it can be done. So, yeah. So Evelyn says, I'm 62. Am I safe to visit my granddaughter outside 6 feet away? Technically, yes, but I have grandkids too. It is so hard to stay 6 feet away. I mean, it's just so hard for them not to come in, want to hug you, and those kind of things. It is really hard. So with my grandkids, we've been doing a lot of FaceTime kind of stuff because I think it's impossible to say to them, no, you must stay away, because kids actually like their grandparents a lot. We've got one more here. So if you have more questions, this is the day to get them done. Do you have advice or thoughts for schools providing lunches for kids? Bobby asks. Yeah. So the story is there are a lot of kids who really rely on school lunches for a nutritious meal in the day. I used to think, oh, come on, really, you don't have enough food at home? And yeah, a lot of people don't have enough food at home. And because they don't have enough food at home, they typically get one of their best meals of the day from school. So I think the schools providing lunch for kids is really important, because it's really important that they don't get coronavirus, but I think it's also important that they eat. There are safe ways to do it. Again, maintaining social distancing is a good thing. When the schools are making this, I don't think there's much danger in making them as long as they can maintain that social distancing. And again, the story with social distancing is you don't have to be perfect. If you're in the grocery store and somebody crosses you for a second, your chance of actually getting sick from them is very low. So I wouldn't worry too much about that. It's the prolonged contacts that we see that worry us the most. So I think advice for school lunches, I think that's probably okay. So bleach solution, that's what we get. So we have the best staff here. So if you use 5 tablespoons, which is 1/3 of a cup of bleach per gallon of water, that's the optimal way to go ahead and do it. That's a fairly weak bleach solution, and that works well. And it also doesn't take the color out of stuff as much. So how are the homeless, Christy asks, how are the homeless being informed of the virus or how to prevent it? How can we as a community help? Well, there are groups that are relatively easy to get the word out to, everybody who's listening today. But there are people who are very difficult. So we work with the people who are working with the homeless population to see if we can get the word out. But this is a really difficult group. A few months ago, before COVID was here, we were working with the homeless population about hepatitis A, and it was hard to get the word out. Many of the homeless are very skeptical of governmental people, and so we worked hard, and I don't think we did a good job. So Christy, if you know a good way to do it, let me see. The other thing that kills us is alcohol solutions. And what's the difference between allergies and COVID-19? So we've answered this before, but it's a good question. So allergies can make you feel miserable, but almost everybody has allergies when they say where it hurts and they point to their nose. They've got a runny nose, usually clear runny nose, almost never a fever, a lot of sneezing, maybe some cough, but most times not a bad cough. So runny nose, clear runny nose especially, no fever, a lot of nasal congestion. COVID causes almost no nose symptoms. So it is remarkable when you talk to people who have COVID that they say, my nose feels funny, but it's not the least bit runny. With COVID, fever, achiness, really feeling bad, and a deep cough are very typical. So they are kind of different. Now, on the first day, could you tell the difference? No. So on the first day, you might feel a little bit down or whatever. So if you're feeling that, stay home until it's clear what you have. So how long does it stay on paper, and what's the best way to clean it off? So it probably can live on paper for a little bit of time. So you can imagine if somebody coughed on the paper and then you picked it up and then touched your eyes, you could get it. So that's the reason to not touch your face and your eyes and to wash your hands a lot. And what's the best way to clean it off? Actually, the best way, there's no good way to clean it off paper. The best way is to leave the paper out for a little bit, and it will do that. The question is, can dogs carry on their fur? I don't know the answer. I will look it up. And so do we have a death from COVID in Douglas County? We do not yet. Now, I think it's pretty likely that at some point we will, but at this point we don't. Now, there are a couple of people who've died in the last few weeks, and they've died for unclear reasons. In all those cases, we've done tests for COVID, and the COVID has been negative. Now, COVID is a bad disease, right? And with a high death rate. So again, we would be not surprised if we would have a death. So the death rate in different places is different. The death rate in Italy is about 10%. The death rate in the US is about 5%. So it would happen. So should we go shopping for food or have them delivered? Shopping for food is fine. I went to the grocery store. I love to cook. So I went to the grocery store twice this weekend to get stuff. And I was very careful about social distancing, and I had no issues with social distancing there. The grocery store I went to already had the shield up. I paid with my card, bagged my own groceries. I did not have any social contact. So I think shopping for food is okay. Having delivered is okay too. Actually, the very best would be for you to shop for food and then deliver it to somebody else who's stuck in the house. That would be really good. So will the heat in a dryer kill it? Yes. So we think this virus is killed at about 130 degrees. Most dryers are above that. So yes, the heat in a dryer will kill it. And that's why if you took this mask and washed it and put it in the dryer, it would take care of it. So should you be concerned if a child has had RSV prior? So RSV is a disease called respiratory syncytial virus. And unlike this one, which is really bad for old people and not so bad for kids, RSV is the other way around. RSV is terrible for babies and then gets less as we get older. So that for people in their teens, they get RSV, but they just get a little bit of a cold. Whereas when kids get it, they get really bad. You would think that RSV and this would be bad together, but apparently not. China had a bad RSV season and a bad coronavirus season, and they didn't seem to have troubles. So if somebody has asthma and coughing but no fever, should they be worried? Well, you shouldn't be worried so much about COVID. They should be worried about their asthma. So one of the things we're telling people is that, just because COVID is around, it doesn't mean that asthma and appendicitis went away, right? So we're still having those other kind of things. So if you have asthma, this is a time to try and get your asthma under really good control. So I talked to somebody the other day, and they have a history of asthma, and they weren't really taking their meds and whatever. This is a time really, truly to talk to your doctor, get on your good meds, and do it. So is testing being done anywhere other than the fairgrounds in Douglas County? So as I said early on, we're going to be doing it in Reedsport on Saturday. We're going to be doing it here in Douglas County on Friday. I think within the next week or two, we're going to have a more comprehensive daily testing center, but I don't want to get ahead of myself. So on Friday or Monday, I should know more. So if self-quarantine is necessary, should you stay away from your children? The answer is yeah, if you could. Now, sometimes you can't. Sometimes people share a bedroom and you can't. But the ideal way to self-quarantine is to have your own room, to use the bathroom only when somebody else is not using it, to have your food delivered to the door, wait until they leave, pick it up, eat it, put it out the door, and then have them pick it up when it's done. So that's the ideal way to do it. Not everybody can do that. But again, it's the number of close contacts. And so the difference of sleeping with your spouse when you have it versus sleeping in different rooms could be important. So people want to know why people with diabetes are increased risk, and we don't know. People with diabetes are increased risk for a lot of things: heart disease, stroke, circulation problems. So we don't know why people with diabetes are, but diabetes is a risk factor for many diseases. At some point we'll do it. So Lara asks, does wearing a mask make asthma worse? Probably not, but wearing a mask is uncomfortable for anyone. And if you're already having a little bit of trouble breathing, it's really quite uncomfortable. So I don't think it particularly makes asthma worse, but it may make that sense of breathing bad. So can food handlers transmit the virus during food pickups? Maybe, but we do not think that this is a predominant way that this gets transferred. So, most food is cooked to over 130 degrees, which would kill that. And so we do not think that this is a particularly typical way that the disease gets spread. So, have any patients reported a burning sensation in their chest? Yes. So the three things that are very peculiar about this illness is people who complain of pressure or burning in their chest, people who complain of a terrible backache, and that people who complain of dyspnea, that's shortness of breath, those are three things that you almost never get from the typical cold. Things you almost never get from asthma. Those are things you almost never get from allergies. So that burning sensation, that heaviness, and that shortness of breath is important. Also, people have reported a decreased sense of smell. We checked it out and we couldn't find that. So again, for people who listened last week, we had 43 people. And before we tested them, we checked to see if they could smell a cotton ball soaked in orange, and then whether they could smell a cotton ball soaked in Listerine. I could really smell it, so it really had quite the odor. 7 people couldn't smell. When we did the test, 3 people had positive tests. None of the people who couldn't smell had a positive test, and none of the people who had a positive test couldn't smell. So, at least in our small group, it didn't show anything. So are people with Parkinson's more at risk, Jackie asks? Probably, although there were not enough people with Parkinson's in the Chinese data to know for sure. Parkinson's got lumped into neurodevelopmental issues, which could be all kinds of things, Parkinson's, stroke, other kind of things. And they were at increased risk, so I think they probably are. So is there any truth to the rumor that azithromycin and chloroquine will cure COVID-19? So as I said earlier, we don't know. The president pushed it. Then Dr. Fauci said later in the week he didn't think there was going to be much use. Then there was this report today that said it might be a little bit use. So the answer is, I don't know. We'll know soon. Would the pneumonia vaccine provide any protection from this? So the pneumonia vaccine that we have out there protects against a germ called pneumococcus, a bacteria. And so I would really encourage people to get a pneumonia vaccine, especially if you're in the right age group, especially if you're a smoker. And it will provide protection against pneumococcal pneumonia. It doesn't provide any protection against this kind of pneumonia. So what's the best way to boost your immune system? I think there are a couple of things. One is exercise. One is a little bit of outside activity, lots of sleep, good diet. Some people take vitamins. I think that's okay, but those are the best way to do it. Is it safe to eat fresh produce? Absolutely. So fresh produce is a good thing to eat, a lot of vitamins. So can you explain the chart again? Angelique asks. So let me get up here and try not to cause a catastrophe. So what this is Douglas County, and each of the cases is surrounded by a colored circle. The colored circle is typically the areas that somebody who lived in that area would go to. So probably the people in Reedsport don't go in the ocean, but they might go out in this area here. And each circle is a place where somebody had a case. And early on I said, these are really scattered throughout the county. And these are really scattered throughout the county. These are the places where about 90% of the people in the county live. There's a couple of people out here and a couple of people out here, almost no people out here. And so really the disease is in places where people live, and you can see these circles really overlap. So not surprising that people who live in Sutherland might come down to the grocery store here or to Lowe's. Not surprising that people in Winston might come into Roseburg to go to a restaurant. And so that's where these overlapping circles are. So really suggests that it's everywhere, and you shouldn't think, oh, I live in a place that's not there yet. It is, we think, everywhere. So have the new tests arrived that take 15 minutes to get results? They have not shipped yet. And we have checked with every clinic in town, and nobody has the machine, which is called an Abbott ID Now machine that runs these cartridges. So, we called to see if we can get one of those machines. And as I jokingly said, we're 30,000th in line, but they're not even taking orders for those machines. So it's unlikely that we'll have one of those machines anytime soon. I'm sorry to say that. Now, it turns out that there are probably other companies that will be making this. And it's not like the people in Roseburg don't test. We just don't use that machine. And so when it comes out there. So they say not to touch your face. Can you itch your inner ear? Well, you can't itch your inner ear because it's way behind your eardrum. But could you itch your ear canal? We don't think the germ lives in your ear canal, so you could do that. But again, it's really hard not to touch your face all the time, and that's why we would want people to do that. Because you could imagine, let's say there was germs here and I did it and then rubbed my eyes. The germs can actually grow on any mucosal surface, so that's any moist surface, and then move their way down. So that's why we want people not to touch their face. So will this come back in the fall like the flu, Patty asks. We don't know that. The Chinese have certainly seen that although they got down to a time where they had no cases, they're starting to see new cases. And their new cases are probably maybe cases that had some asymptomatic transmission in the middle, maybe visitors who came in. So it's likely to come back. Unfortunately, it is not going away like the flu does. So January and February are kind of a bad time for a pediatrician, right? Everybody's sick. Babies get RSV, people get the flu, people get strep. And about President's Day every year, I think, oh God, I hope this is over soon. Because by February, I say everybody's tired of being sick and sick and tired. I mean, people are just miserable by February, but it comes usually the first nice days in February, and strep starts to go down, RSV goes down, and flu really does kind of magically disappear. And it usually magically disappears in places that are warm before in places that are cool, not surprisingly. This one is not behaving like the flu. I mean, if you look at what's happening in Florida and Louisiana, it's just exploding in Florida and Louisiana, where flu is almost gone. So this is not behaving like flu to go away in the summer. What we think is going to happen is that we'll beat this down until the point where we have a manageable number of cases. So I would think a manageable number of cases in Douglas County would be 20 or 30, and we would just attack those 20 or 30 cases and quarantine people and check the people around them. And so we would try and keep it at that low level. It's likely to stay at that low level for a long time. So let's say we had 20 or 30 cases in a month. So 20 or 30 cases, that would probably mean maybe 4 or 5 hospitalizations. That would not overwhelm the system. And even at the highest death rate, we're talking about maybe 1 or 2 deaths a month. That's still 1 or 2 deaths too many, but nothing like the death thing that they're seeing in New York, where they're having to bring in these refrigerated trucks to haul off the dead people. So I think this is it. So why is China most referenced for research about COVID? Because they got it first, and when they got it first, they did the research. So, you have to do the research, and then it takes a month or 2 to put it together and come out. So they had a lot of cases in January. They wrote it up in February, and they published it in March, and that's why it's March, now April, and we can report on that data. The cases in the United States didn't really start till March, which means that the data that we learned from the United States won't come out until April or May, and that's why we have to use the data that we have. The data that we have from the U.S. is mostly anecdotal. That means stories that people tell. And so I read one just heartbreaking story this past weekend from an ED doc in New Orleans who said he'd seen hundreds of cases, and it was just terrible. And his sense was that the hydroxychloroquine didn't really show much difference. But again, he's only seen some people. He's not seen enough to make a study. So is zinc helpful to treat COVID? We don't think so. Zinc, however, is a perfectly good thing to have. We all need zinc in our diet. So taking zinc, I would have no issues. Now, it is interesting that this disease causes a decreased sense of smell. The only other thing that causes a decreased sense of smell is zinc. So I don't know what the connection is on that, but that is a concern. So is there a concern with how town is still extremely busy and people aren't staying at home? Actually, it's not that busy. I had some chores to do this weekend, and I was out. I had some work chores to do, and then I also went to the grocery store. And I don't think it's extremely busy. I mean, I think the business is down a lot. I had to go to Lowe's to pick up some supplies for our drive-through, and people were very good at maintaining social distance. So I think actually, Oregon, we're doing a great job. So, why can fast food workers work in such close quarters? They really shouldn't. What happens, unfortunately, is they're having takeout, so nobody sees what's going on. They shouldn't be. They really should be socially distanced. Although fast food is considered to be an essential work and they can be open, that still doesn't mean that they shouldn't appropriately distance. And that may mean, for example, that you can't have 2 fry cooks. If you can't have 2 fry cooks, you should go with no 2 fry cooks. We do not want these people getting sick because we need them. So how to help people with big panic attacks over coronavirus? Well, unfortunately, during the time that anything is bad, people who have panic attacks are more likely to have more panic attacks. So I would really, really have you talk with the people who help you with those. And whether that's a counselor, a massage therapist, a priest, or a behavioral therapist, please talk with them. There are some really good things that people can do for panic attacks, and I think this is an important time to do it. So how about taking vitamin A and D? Again, no data about vitamins making this better or worse, but you know what? We don't think there's any problem from taking the normal amounts of vitamin A, vitamin D, vitamin C, zinc. So if you want to take those things, fine, but whether that's a problem. So Vanessa asks, should we be drinking whiskey or tequila? She's asking for a friend, I'm very sure.
That's not from me. But
not from you. Okay, it's not from this Vanessa. The answer is yes. I think both. So the story is, this is a time that if you drink in moderation, it's perfectly fine. Most of us are staying at home, so drinking a little bit in moderation is perfectly fine. There's nothing to suggest that drinking in moderation would either cause issues. Now, obviously, we don't want people to drink and drive. We don't want people to drink until they get drunk. But a little bit of whiskey or tequila is fine. And I'm going to celebrate tonight with a gin and tonic. So Heather asks, how many projected cases will we get? Are we in the worst time right now? So you guys have heard that I'm a nerd. And I really am. There are 7 different models of the way this disease is going to go over the next month. And so I'm also a weather nerd. And so if you remember when you get hurricanes, right? That's a hurricane in the Atlantic and it's going barreling towards Florida. And what they show is they show a little cone there where they're very sure where it's going to be in the next hour, but you get 2 days out, 3 days out, 5 days out, the cone increases. So it looks like in the beginning, like, it's headed straight for Florida, but it then goes farther north or farther south. And that's almost exactly the way it is with this. So we have 7 models that we're using. The worst model suggests it's going to get really bad over the next month. That model is the model that it will go as fast as it did in New York. So if it goes as fast and as wide as it does in New York, it's going to be terrible. But at least now we're seeing a real divergence from that, so I don't think that's going to be the case. There's one model that suggests that it's not going to get very bad at all. It's going to basically have almost no cases in Oregon. We've already had more than no cases in Oregon, so I don't think that one's right. So there's a model we've been using that we call the Roseberg model that suggests that this disease will double every 4 days until we have 10 days of distancing. Once we have 10 days of distancing, which is about 2 typical incubation periods, we'll then double every 5 days for 10 days. And then for 10 days, we'll double every 10 days. And then we'll start to have a decrease every day. So that would suggest for 30 days, it's going to rise, and then it's going to start falling, which is about what they saw in China, about what they saw in Korea, about what they've seen in areas where they've gotten in Singapore, where they've gotten this under control. So that's where So I don't think we're in the worst time right now. I think the worst time is going to be in the next 2 or 3 weeks. Because what happens is people don't just get this and it's over. So this is not like car accidents where people get run over and they die right away. These are things where people are sick for a long period of time. They're on a ventilator for 2 or 3 weeks. And so they build on top of each other. So I think the worst of it is going to be towards the end of this month, and then it will start to get better. So how can we keep cases low if people are allowed to start going from country to country again? So so it's not just country to country, it's city to city, right? So going to New York City is just as bad as going to China or Korea. So it's going to be people traveling at all. So how are we going to prevent that? Well, I think what we're going to need to do is we're going to need to get the disease under control in those places before we do that. And the definition of under control is a little bit in question, but I think you really need to get the cases under control before we start doing a lot of traveling. So when will more testing be available? Well, again, we're doing as much nasal swab testing as people want. We have not turned a single person away from the clinics. So, and in fact, the clinic we did, I think it was yesterday, was not full. So we were done early. We had more swabs. We had more things. So I think we are now doing as much testing as doctors order. Now, more testing would also be better testing, like antibody tests, More testing would also be testing that you get back the next day. My answer is, I hope tomorrow. But again, as I said in the last time, I have been misled so many times that I wouldn't know. So the question is, how many confirmed cases do we have now? So early on, confirmed cases were ones that were done at the state and then confirmed at CDC. They've gotten rid of the CDC confirmation, so we're just calling them cases now, and we have 10. Deanna asks, are certain blood types more at risk? There's certainly a report that people with one blood type or another may be more or less likely to get it. But again, I think that may be an ethnic difference in blood types. Again, since blood type is not something you can change, I don't know. So will a positive antibody test need to be sent for confirmation? We do not know the answer to that. Again, I saw the first specs on one of them, and they sounded good. They sounded like they had over 90% sensitivity and specificity. So that's a good test. Generally, antibody tests do not need confirmation. So somebody says, does ibuprofen make this worse? And again, there was a report from Europe from one person that in their very small series, ibuprofen seemed to make it worse. It's a little hard to know. Nobody else has confirmed that. So again, until we get full studies, we won't know. At least the anecdotal data from other people is probably not. But again, if you have it, you don't need to treat the fever, and Tylenol seems to work perfectly fine. Okay, so we're running out of questions here. That's always a good thing. Can you be swabbed to check to see if you've had it early in the year? No. So the test to know if you've had it early in the year is going to be a blood test, because the antibodies don't live very well on the surfaces. They live great in your blood. So they're going to be what's called an IgM and an IgG blood test. And there's very little IgG and IgM in your mouth. You really need to do a blood test for it. And that'll be a good test. So when this is out, we're hoping that everybody who thinks they had it in January or February gets the test, and then we'll figure out if you really did. Because I don't know whether you did. There are a lot of people with bad things in early February. And I don't know if that was COVID or something else or just crud. Because, in the screening clinics, when people are sick with this crud, only 3 of 43 were positive last time. So I don't know what in the world the other 40 had. Okay, so I'm getting the boot here. So how many cases? So we've had 10 positive cases, 268 negative cases. Now, for those of us who are nerds here, suggest this is about a 4% positive rate. That's a good sign. So when your positive rate is less than 10%, it means the disease is not about to take off. So there was one place that told me that they had a positive rate of 30% in the swabs that they did, and a week later they were just overwhelmed with the number of cases. So at a 4% positive rate, it's here, but it's not widespread here. So what's my risk? Well, your risk of getting it is how many people you get exposed to. So again, if you can decrease your exposures, decrease your close exposures, stay home, you can decrease your risk. So what's the best way? Keep your space. If you can stay home, stay home. When you go out in public, keep away from others, stock up on supplies, avoid crowds, certainly avoid cruises. And during COVID outbreak, stay home. And if you want to wear a mask to prevent others from getting sick, you can do that. So other than hand washing and surface sanitizing, are there other recommended precautions I can take? Yeah, wash your hands, soap and water for 20 seconds. Cover your mouth when you cough or sneeze. Stay home if you're sick, but stay home and keep your immune system strong. Like we said before, eat a good diet, get enough sleep, get some regular exercise, take care of your underlying health conditions, especially if you have asthma. And especially if you have mental health issues, call your therapist, because this would be great. Again, our hotline is still open, 541-464-6550, 7 days a week, 8 a.m. to 7:30 p.m. The people who do this really deserve a round of applause. These are people who are spending their Saturdays with us all day, taking phone calls and whatever. They don't have to do this. They could be at home doing something else, and yet they do it for us. So you need to thank them. Again, it's 541-464-6550. Okay, so how can you be a carrier without symptoms? Who knows? I mean, that's one of the things about this germ, which is so problematic, is these people who have spread it when they don't have any other symptoms. And we do not know that. Because what's interesting is there are some people who have this and they don't even spread it to the people in their own house. And then, for example, this guy at this cocktail party who spread it to 40 people at a cocktail party. So we do not know this in this story. So the question, what's the percent of false negatives? So the percent of false negatives depends on what test you do. Pretty much for outpatients, the only test you can do is a nasopharyngeal swab. And it's probably got a 30 or 40% false negative rate. That means when you get that if you had 100 people have the disease, you knew they had the disease, and you swabbed their throat, 30 or 40% of the time the test would come out negative. And that's because there's a lot of virus in your lungs, not much in your nasopharynx. And that's why you can't do just a little front nose swab that you can do for the flu, because there's not very much stuff there. You really have to stick this in a long way. So is the country ensuring that any positives have ensuring that any positives home quarantine identified if they need home health services? Absolutely. So our people are staying in touch with them. We brought meals out to them. We brought medicines out to them. We are really paying attention to them. And for the most part, people have been very good about self-quarantining. We have an occasional person who isn't, and then we give them a really nasty note. We can actually have the police enforce it. But look, we don't want to have to do that, right? We don't want to make this a police state. We want people who are sick to do the right thing, not really for themselves, because quarantine doesn't help them. It's helped the rest of us. So are underage workers in fast food essential? Who makes that decision for youth? The answer is I do not know that question. That is not a public health question, but I'll see if we can find it. Does it live on shoes? Probably not particularly well. So shoes, again, they may catch a little bit, but we tend not to be really close in handling shoes. So is bar soap the same as liquid? Yep. What it is, it's the saponification, which destroys the lipid layer in this. So anything that makes suds, any kind of soap that makes suds is great. Bar soap makes great suds, so it's great. So is a face shield more effective than a mask? So a face shield, and I bought one this weekend at Oregon Tool and Supply for my shop, and I brought it in for this. And the face shield is effective in a couple of ways. It certainly is effective at you not spewing germs, so yes, it would work. It's also good because you can see somebody's face. It's much more comfortable than a mask. The problem is it is good as you not giving the germs, but because air can get in, it's not particularly good at preventing you from getting other people's germs. So a face shield and a mask is more effective. It's really uncomfortable though. So what is the hospital doing to prepare for an influx of the ill people? They're doing a lot. So they basically canceled all elective surgeries. They're maximally preserving equipment. They are making plans to use other areas of the hospital in case they have an influx of ill people. They're training up staff to go ahead and take care of them. They're readying anesthesia machines to be ventilators. They're planning for a screening clinic. So they are doing a lot. So I think I was on the call with the hospital about 4 times today talking about the things they're doing. No hospital is going to be perfectly prepared for this, but I'm very confident that Mercy is about as well prepared as anyone to take care of this. All right, I'm seeing a dearth of questions here, and it's almost 7 o'clock. So let's tell you again. So we have 10 positive cases, 268 negatives, and that's as of today at noon. That is not an April Fool's joke. The hotline, 541-464-6550. Our next screening clinic in Roseburg on Friday. If your doctor thinks you need a test, we're there to do it. On Saturday, we're going to do this in Reedsport. If your doctor in Reedsport thinks you need it, we'll do it. And you can always get more information at our website, which is www.douglaspublichealthnetwork, all one long word, .org. You can find us on YouTube, on Facebook, and all those other things that I don't know much about. So are there any other questions? Okay, well, with no other questions, we'll call it a night. Thank you again. We'll do it again on Friday. And again, if for some reason your question didn't get answered because we've answered it before or whatever, please be nice on Facebook, and I will try and answer them later tonight or early tomorrow morning. And then we'll see you again on Friday. Again, this is Dr. Bob Dannenhoffer. Thanks.